As I speak to you tonight, our hospitals are under more pressure from COVID than at any time since the start of the pandemic. In England alone, the number of COVID patients in hospitals has increased by nearly a third in the last week to almost 27,000. And that number is 40% higher than the first peak in April. It's clear that we need to do more together to bring this new variant under control while our vaccines are rolled out. In England, we must therefore go into a national lockdown which is tough enough to contain this variant. That means the government is once again instructing you to stay at home. You may only leave home for limited reasons permitted in law, such as to shop for essentials, to work if you absolutely cannot work from home, to exercise, to seek medical assistance, such as getting a COVID test, or to escape domestic abuse. If you are clinically extremely vulnerable, we're advising you to begin shielding again, and you will shortly receive a letter about what this means for you. And because we now have to do everything we possibly can to stop the spread of the disease, primary schools, secondary schools, and colleges across England must move to remote provision from tomorrow. If our understanding of the virus doesn't change dramatically once again, if the rollout of the vaccine programme continues to be successful, if deaths start to fall as the vaccine takes effect, and critically, if everyone plays their part by following the rules, then I hope we can steadily move out of lockdown, reopening schools after the February half-term and starting cautiously to move regions down the tiers. The weeks ahead will be the hardest yet, but I really do believe that we're entering the last phase of the struggle, because with every jab that goes into our arms, we are tilting the odds against COVID and in favour of the British people.